Today, we'll talk about the 1 vitamin D danger and 2 big mistakes you could be making when taking vitamin D supplements. You could be taking vitamin D wrong in a way that not only makes it ineffective, so you can't actually absorb or use it, but could actually be dangerous. This video will show you an easy way to make sure the vitamin D you're taking is effective and also prevent it from being dangerous, so let's get into it. As always, this video is educational and does not constitute medical advice. First, let's look at why vitamin D supplementation is necessary for many people. Vitamin D deficiency is a common global issue, with approximately 42% of adults in the US being deficient. This is largely attributable to our modern lifestyle. We spend a lot of time indoors, so we don't get enough sunlight to produce vitamin D in our skin. Using a lot of sunscreen can also limit vitamin D production. This is especially true for those with darker skin, as they need more sunlight to make an adequate amount of vitamin D. Plus, there are few foods that are rich in vitamin D, such as cod liver oil, certain mushrooms exposed to ultraviolet light, and foods fortified with vitamin D. If you have a condition that makes it difficult for your body to absorb vitamin D, like inflammatory bowel disease, liver disease, or cystic fibrosis, or if you take certain medications, such as cholesterol-lowering drugs, you may also have a deficiency in vitamin D. Also, some studies suggest that exposure to endocrine-disrupting chemicals found in polluted air, water bottles, cosmetics, pesticides, and heavy metals can lower vitamin D levels. As you can see, there are many factors that can increase your risk of vitamin D deficiency, and your body absolutely needs vitamin D to ensure it functions optimally. Vitamin D plays a critical role in strengthening the immune system, aiding in calcium absorption, and supporting heart and brain health. It also activates and deactivates genes that can cause diseases. Studies have shown that vitamin D can turn off genes that cause cancer and turn on genes that are essential for the immune system to function properly. So it's hardly surprising a deficiency of vitamin D can be dangerous. When vitamin D levels drop below the threshold level of 30 nanograms per deciliter, it puts you at risk of serious chronic diseases like heart disease, cancer, and disorders that attack your immune system. Signs of vitamin D deficiency include weakened immunity, feeling tired, fragile bones, feeling sad and low, hair loss, and muscle or joint pain. Many people take vitamin D3 supplements to ensure they're not deficient, but at least 50% of the time they're doing it wrong. That's because they're missing 2 other nutrients that help your body use vitamin D effectively. This is important because supplementing with vitamin D without these 2 other key nutrients can weaken your bones and contribute to plaque buildup in your arteries. Now let's talk about the first important nutrient, magnesium. Before you take vitamin D supplements, it's important to consider if you are getting sufficient magnesium in your diet. Magnesium is a cofactor or helper in hundreds of enzymes that are essential for various biological reactions. This includes the enzymes responsible for the activation and metabolism of vitamin D in the body. Vitamin D, in either the D2 or D3 form, is biologically inactive until it is converted into its active form, calcitriol. For this conversion to happen, the enzymes present in your liver and kidneys need to use sufficient amounts of magnesium. Now, the more vitamin D you take, the more your body uses magnesium. If you have low levels of magnesium, your body won't be able to use vitamin D properly. In other words, the vitamin D you're taking won't be effective. This can definitely impact your bone health, immune function, and overall well-being. It's estimated that about half of the population have low magnesium levels because of factors like soil depletion, chronic stress, not eating enough magnesium-rich foods, certain medications, digestive problems, and alcohol consumption. Studies have shown that low magnesium levels can reduce vitamin D levels, and taking magnesium supplements has been found to help reverse vitamin D deficiency. According to the National Institutes of Health, the recommended amount of magnesium is 400 to 420 milligrams per day for men and 310 to 320 milligrams a day for women. If you experience muscle twitches, tremors, and cramps, poor sleep, lethargy, and heart palpitations, This could be because you aren't getting enough magnesium. One way to replenish your body's supply of magnesium is by eating foods such as almonds, pumpkin seeds, mushrooms, cashew nuts, and spinach. If you're thinking about taking a magnesium supplement, consider magnesium bisglycinate. For a lot of people, this is the best form of magnesium to take because it's absorbed well by the body and is unlikely to cause digestive issues. Getting enough magnesium benefits you in a variety of ways, such as relieving muscle tension, reducing stress, helping with your nervous system and your body's synthesis of proteins, and of course, utilizing vitamin D. If you suspect your magnesium levels are low, you may just want to supplement without taking a blood test. This is because a blood test is not a good indicator of magnesium levels, as only about 1% of your body's magnesium is found in the blood. Now let's talk about the second nutrient you absolutely cannot ignore when taking vitamin D. A JAMA study published in 2010 found that women aged 70 years or older who receive very high doses, 500,000 IU, of vitamin D3 every winter for 3 to 5 years, were more likely to experience falls and fractures. You may find these results surprising since one of vitamin D's primary functions is to absorb calcium in the intestines into the bloodstream, and it's widely believed that more calcium equals stronger bones. As it turns out, calcium absorption is only one part of the picture. An excessive intake of vitamin D can actually have the opposite effect. In another 2019 study, people who took either 400 IU, 4,000 IU, or 10,000 IU of vitamin D over 3 years didn't see any improvement in bone density. In fact, those who took the highest dose had a decrease in bone density. To understand why more vitamin D does not lead to stronger bones, you need to know that vitamin D stimulates the formation and activation of osteoclasts. Osteoclasts are specialized cells that continuously break down old or damaged bone tissue so that new bone can be rebuilt to maintain bone strength. During this process, calcium is released from the bone for use throughout your body. This blood calcium is vital for nerve transmission, blood clotting, and muscle contraction. This means that now your body needs to deliver more calcium to the bones. The problem is that vitamin D cannot tell calcium to go to the right places like your bones and teeth. In order for this to happen, your body needs vitamin K2 in the form of MK7. So vitamin K2 is the second missing piece of the puzzle. Here's what should happen. The active form of vitamin D helps your body absorb calcium into the bloodstream. Then, vitamin K2 activates the protein, osteocalcin, which instructs your cells to transport the calcium into your bones and teeth. And vitamin K switches on another protein, MGP, which prevents calcium from accumulating in the soft tissues of the body. If you take too much vitamin D without an adequate intake of vitamin K2, there will be excessive calcium in the blood. This can lead to calcium being deposited in the kidneys, arteries, and other soft tissues. In other words, taking vitamin D on its own can lead to calcified arteries and put you at risk of heart problems. Studies have shown that people deficient in vitamin K2 are more likely to develop calcified arteries. They also show that supplementing with vitamin K2 prevented blood vessel calcification in animals and reduced the risk of calcification in humans. Make sure you're getting between 100 and 300 micrograms of vitamin K2 per day. You'll find vitamin K2 in grass-fed butter, cheese and meat, pastured-raised eggs, beef and goose liver, natto, sauerkraut, and eel. So now you understand the importance of getting sufficient magnesium and vitamin K2 along with vitamin D3. Most people are lacking in one or both of these nutrients, and this can significantly impact their overall health. So how much vitamin D should you get daily? The generally recommended safe upper limit is 4,000 IU of vitamin D per day. However, individuals who are deficient in vitamin D may need to take a higher dosage, and it's important to consult a healthcare professional to determine the appropriate amount for you. If you enjoyed this video, like, share, and subscribe, and click on the bell icon so you never miss a video. And now, over to you. Are you getting enough vitamin D, magnesium, and vitamin K2 daily? Leave your comments below. We'd love to hear from you. And click the link below to get your free anti-inflammatory diet plan.